Welcome to EEG Station. For this video, we are going to discuss the perhaps underutilized capabilities of quantitative EEG, or QEEG, within the pre-surgical epilepsy patient domain. It should be mentioned, however, that QEEG is underutilized as a diagnostic tool in multiple arenas, including its superb ability to clearly articulate the insidious background changes related to cerebral ischemia, which occurs during active EEG monitoring. We intend to cover that topic on another video lecture. Though the Wada test is no longer the lone procedure used for lateralizing hemispheric dominance, that is, the hemisphere that controls language and memory, as a preparatory component in the pre-surgical planning for refractory epilepsy surgical candidates, its value maintains as evidenced by its continuing utilization at many epilepsy centers across the United States. Additional methods, such as functional MRI, have shown promise due to less risk, including reduced invasiveness. Nonetheless, the meaningfulness of the Wada procedure persists. And while those alternative procedures may carry less relative risk, they don't necessarily offer remarkable improvement in diagnostic accuracy. The Wada test is an effective and essentially benign procedure which can be performed in an outpatient environment. The electroencephalograph, EEG, occupies a prominent role in Wada tests as it contributes a streaming viewport of cortical functioning, including the indication of acute sequential electrocortical changes associated with the administration of sedative medication, in this case confined to one hemisphere at a time, such as amobarbital amytal or propofol. It is crucial that the neuropsychologist performing the language and memory assessments is accurately informed of electrocortical changes imparted by the sedative and of the time when the patient's background has returned to a baseline state, that is, the slowing has resolved. Note that encephalopathic patients with alterations of orientation and/or awareness tend to correlate with EEG backgrounds that contain some degree and form of generalized slowing. In this example, generalized rhythmic delta activity, or GRDA, with frontal predominance is presented. In addition, patients with focal pathologies tend to have EEGs, which record focal slowing and/or attenuation of faster frequencies, and perhaps voltage in that particular region. To what degree, if any, that regional dysfunction impacts the patient's language and memory functions is at least partially dependent on whether or not it is located within the patient's dominant hemisphere. In this example, right temporal lateralized rhythmic delta activity, or LRDA, is shown. Thus, the transient slowing imparted by the sedative during the Wada test can be thought of as a temporary and reversible cortical dysfunction. To what degree, if any, that induced slowing has on the patient's language and memory functions is what the neuropsychologist must determine with respect to each hemisphere. This information appropriately regulates the progression through the sequence of language and memory testing, including when to proceed with memory recall and when to initiate testing of the contralateral hemisphere. For example, it is necessary to ensure the patient has returned to baseline before contrasting sedated responses with baseline ones. The implication here is that isolating the particular dominant hemisphere is dependent on accurate data. Such isolation is vital to ensuring that eloquent cortex is not irreparably damaged if surgical removal of the epileptogenic region is eventually performed. First, let's take a look at how utilizing QEEG can assist with assessing background changes over a larger expanse of time. Those changes may or may not be practically impossible to identify when only reviewing unprocessed EEG. A focal right hemispheric seizure began here. The seizure concluded here. Notice the intense period of right hemispheric post-ictal slowing. It begins here and ends at this approximate point. This example burdens us to recognize that during the patient's baseline state, that is, their interictal EEG, there is continuous right hemispheric slowing, as is highlighted here. And here. The inclusion of quantitative EEG, QEEG software, such as Persist, can provide substantial assistance to the otherwise relatively subjective and challenging task of translating real-time unprocessed EEG for the identification of salient background changes secondary to administration of the sedative. This includes pinpointing the beginning of background changes as well as identifying the time at which the background has resolved to its baseline state. Consider the implications if the neuropsychologist who is reliant on the bedside EEG team members to inform them of when the EEG background has returned to its baseline state receives incorrect information. Although the neuropsychologist proceeds to test the patient's recall aptitude for the particular sedated hemisphere, the patient is in actuality still functionally impacted by sedative effect. Quantitative trends such as alpha-delta ratio, fast Fourier transform (FFT) spectrogram, peak envelope, amplitude asymmetry spectrogram, and Persist's proprietary rhythmicity spectrogram saliently articulate such changes across time and space in a coherent, consolidated language. This figure displays a 1-hour QEEG epoch of the EEG recording, which always accompanies the Wada test. EEG changes throughout the progression of the procedure are encapsulated, and key time points such as the moment of sedative administration, as well as time of return to baseline, are essentially partitioned from adjacent tracings. As the right hemisphere is sedated first, tangible background changes can be observed in several trends including peak envelope, bottom trend, amplitude EEG, second to last trend, FFT spectrogram of the right hemisphere, second from top trend, rhythmicity spectrogram for the right hemisphere, fourth trend from top, and asymmetry relative spectrogram, ARS, fourth from bottom, within that hemisphere. The abrupt, discrete appearance of dark red shading within the ARS trend is representative of the exact time of intravenous sedative administration. The vertical, dashed black line represents the moment of injection across all trends. The diagonal black arrow points to the moment of injection within the ARS trend. With respect to the ARS, the process of return to baseline is mirrored by the settling back down of the relative color intensities, red equals right, blue equals left, across several frequency bands. In particular, the disproportionate intensities of the red shading within certain frequency bands, notably the delta, theta, and beta bands, becomes more quiescent. This includes the evaporation of the previously increased contribution of beta activity, which is expected with such sedative effect, as it similarly fades away. Let's pause and look at the raw EEG of a different Wada test, which wonderfully displays the abrupt appearance of the prominent beta activity. This epoch is from when the sedative, sodium amytal, was being administered over the right hemisphere. The patient was instructed to count down from 10 as the medication was started. Note the abrupt appearance of intense beta activity, which is confined to just the right hemisphere. Contrast that with the left hemisphere's relative paucity of this beta activity. The increased EMG artifact seen within the left and right temporal regions is likely due to increased physiological stress related to this key point of the procedure. With respect to the QEEG, it is worthy of noting that the intense beta activity lingers for a significant amount of time after the delta and theta slowing has resolved. Essentially, though, the entire right hemisphere's remarkable outlying presence has resolved as the distribution of frequencies gradually returned to its pre-sedation nature as the sedative has been metabolized by the patient. The sedative used during this particular test was propofol, which has a rather rapid half-life. One sedative which has traditionally been relied upon for Wada tests is sodium amytal, which is the drug we just discussed that was used for the raw EEG image with increased right hemispheric beta activity. Its rate of metabolization is comparatively slower. With respect to the trends, it is important to recognize that several trends, including ones not discussed here, can indicate such baseline changes within their respective display parameters.
Hi there, I'm Joshua with EEG Station, and I'm here to support my colleague Alex in presenting this video to you on the QEEG changes expected during the Wada test. As Alex mentioned, within the relative asymmetry spectrogram, the red color represents activity which is proportionally dominant for the right hemisphere. You might have noticed that Alex is wearing red. I'm wearing blue to serve as a sort of representative for the left hemisphere. Perhaps you could say that I want to be left alone. There, a little humor for you. But specifically, we want to pay attention to the disproportionate magnitude of EEG activity seen over that side during administration of the sedative. So here's the same QEEG epoch we presented just now. Pay attention to the vertical dashed black line just to my right. This represents the moment in time across all viewable trends when propofol was administered over the left hemisphere. Since the relative asymmetry spectrogram trend showcases the abrupt background changes over the left in such a visually striking manner, we'll initially focus on this particular trend. That being said, as you can see, several of these trends remarkably convey the salient period of background changes, though within the confines of their respective parameters. Okay, the diagonal black arrow is pointing at the moment within the relative asymmetry spectrogram when the sedative was injected via femoral artery on the left side. Notice that across the spectrum of EEG frequencies, that is from 0 Hz to 30 Hz, there is an abrupt change in the EEG frequency distribution as viewed through the prism of comparing the right hemisphere to the left one. The left side all of a sudden is dominating the scene, and the darker the shading is, the more asymmetric the activity is. So we see that near the beginning of the background change there is a concentrated asymmetry which is widest within the delta band, though which also transcends across the spectrum of frequencies up to the beta band. Speaking of the beta activity, as Alex touched upon, such an initiating increased presence of beta activity is expected with many types of sedative medications, including propofol, benzodiazepines, and barbiturates, along with a sudden appearance of delta band activity over the left. Undoubtedly, even with the artifact reduction algorithm activated as it is here, some EMG artifact associated with physiological stress near time of injection also contributes to the shade intensity at higher frequencies. Alex would like to emphasize something over her hemisphere. Alex.
Thank you, Joshua. So, my blue colleague just mentioned to you about the relatively wide band of blue shading within the delta range. Notice that over the right hemisphere, near time of injection, we also see an outlying, more intense shading of red within the same delta band. It is right here. Now, let's take a look at how some of the other viewable trends articulate the abrupt background changes and the resolution of those changes secondary to administration of sedative. We have for the time moved back to analyze the right-sided injection. Let's begin with the right hemisphere FFT spectrogram, which is positioned here at the second spot from the top trend. Let's briefly discuss what the FFT spectrogram is conveying. The x-axis is simply time. The y-axis represents the spectrum of EEG frequencies that are possible to be recorded from just over 0 Hz to 30 Hz. There is a third dimension, if you will. The presence of specific colors indicates how active the EEG is at particular frequency bands. Very similar to the design of a Doppler radar, some colors indicate a higher intensity, while others a less intensity. This scale defines for us what each color represents. White indicates the highest magnitude of EEG activity possible, while black indicates no activity. A homogeneous coat of black occupying the entire surface area of our trend is what we would expect when recording surface EEG on a patient with electrocerebral inactivity or brain death. In addition, we expect to see this very dark shading in unison with a patient who experiences acute cerebral hypoperfusion. Now, the colors in between white and black, beginning with white, indicate decreasing magnitude within a graded stepwise format. So, activity with a lime green or yellow color is what we would interpret as medium presence. In fact, you can view the y-axis of this trend as a surrogate for the topographical locations of the map, which underlies a Doppler radar screen. Some locations see more intense wind and rain, while other regions don't. The difference here is that instead of presenting variations in intensity based on location, the FFT spectrogram trend shows us variations in intensity based on frequency. And there's good news. Most of the other trends are fundamentally constructed in the same way, with the x-axis representing time and the y-axis representing the possible frequency spectrum of EEG activity, as well as the presence, and if the former is affirmed, the magnitude of activity within particular frequency bands. While certainly other frequencies also are more active at this time, the heaviest shading can be seen within the delta band, as evidenced by the prominent red shading with some small portions that are colored white. Speaking of those other frequencies, we see that a rather broad expanse of frequencies, beginning with the theta band and extending to the beta band, is colored with a green or teal hue. As Joshua mentioned, we see that the faster frequencies, notably beta activity, linger beyond the point at which the delta slowing, or the red shading, has evaporated. And notice that for all of the trends seen here, the contralateral hemisphere is not immune to the effects of the medication. A reasonable hypothesis for this is 1, the mechanism of volume conduction, and 2, compensation mechanisms related to intercerebral blood flow via channels within the circle of Willis. Now, let's briefly look at some of the other trends. This yellow and green trend is actually 2 separate trends which are superimposed. The yellow trend is the absolute hemispheric asymmetry index trend. The x-axis is again simply time, and the y-axis indicates the degree of asymmetry present, if at all. Note that it does not specify which trend is more active if asymmetry is present. The green trend utilizes the same axis formats, though the y-axis includes values greater than 0, values less than 0, and 0 itself. When there is green shading above the x-axis, then that indicates asymmetry with respect to a more active right hemisphere. When the green shading is below the x-axis, the translation is that the left hemisphere is more active at that time. Note that these 2 trends do not articulate how active particular frequencies are with respect to asymmetry. Joshua will discuss our next trend of interest, the amplitude-EEG, or AEEG trend. Joshua.
Thank you, right hemisphere. Thank you, Alex. So the amplitude-EEG trend's x-axis represents, you guessed it, just time. As for the y-axis, we'll first discuss some of the nuts and bolts of the algorithm embedded within. Note that the following specifics are honed to the characteristics of the PERSIST software trend blueprints, though the essential calculations utilized transcend across various software packages. The EEG signal is first downsampled to 64 per second and then asymmetrically filtered. Note how the graph indicates that frequencies over 20 Hz are effectively excluded from the forthcoming calculations. After rectification of the signal, a high-pass filter of 0.5 seconds is applied. The output is then calibrated to show peak-to-peak amplitude. Finally, the min and max values for each 1-second epoch are plotted and connected by a vertical line. Now, the user can alter the range displayed along the y-axis. The blue line, as a default setting within PERSIST software, indicates the left hemisphere. The blue color is my favorite. The red line represents the right hemisphere. When the activity is symmetric between the right and left, the lines are superimposed, and thus the resulting color is a blend of the 2. Observe how for both the right and left hemisphere's time of sedative injection, the affected hemisphere decouples or separates from its homologue. Let's zoom in to better visualize the amplitude EEG trend changes which occurred during left hemispheric sedation. At point of administration of sedative, both hemispheres actually align with a stepwise, though relatively abrupt, increase in voltage. This is likely due to both field propagation as well as compensatory blood flow mechanisms also affecting the right. But at this point, we see that the left hemisphere clearly decouples from the right. The expanse of this increased activity essentially mirrors the progression of sedative metabolism seen in the other trends. Alex will now discuss the peak envelope trend. Alex.
Thank you, Joshua. The peak envelope trend's x-axis simply represents time. In essence, this trend displays values derived from the running average of the maximum or peak absolute values within every 1-second segment of time. The settings for the y-axis have been configured here to be 0 microvolts for the minimum and 50 microvolts for the maximum. Similar to the amplitude EEG trend, the peak envelope trend shows a decoupling of the right hemisphere at the time of its sedation and a decoupling of the left at that respective time. Just like the asymmetry spectrogram trend and the amplitude EEG trend, red represents the right hemisphere and blue represents the left. It is important to mention again that delayed cerebral ischemia, or DCI, that is secondary to vasospasm following subarachnoid hemorrhage, or SAH, is difficult if not impossible to identify if only utilizing raw unprocessed EEG.
The changes over time can be so subtle that without appreciating an expanded time period within one epoch, only possible with QEEG, those alterations will insidiously escape detection. As an analogy, it is likely impossible for you to observe that you have aged from one day to the next.
EEG background changes secondary to Wada sedation may not be as gradual as DCI, though are nonetheless challenging to appreciate through only the prism of raw EEG. Essentially, the advantages to incorporating QEEG in such circumstances align well with the familiar phrase, "you can't see the forest for the trees."
As QEEG can be viewed in real time, along with the raw EEG, its incorporation during the Wada test can reduce subjectivity inherent to the process of determining both deviation from and return to baseline using only unprocessed EEG.
EEG Station would like to thank you for taking the time to watch this video. Feel free to hit that like button, subscribe, and turn on notifications if you are so inclined.